Advice I would give people is accept the fact that you're getting old. Everybody gets old, and we just need to cope with it. Have a younger person come over and check things out. You mentioned rugs, furniture. These can be deadly. A little throw rug can slip, especially if my balance isn't very good or I wake up in the middle of the night to go to the bathroom. A lot of older men have enlarged prostates and they need to get up every couple hours to pee. And a lot of time you're still sleepy. So having no obstacles in the path between your bed and the bathroom is a good thing. But I would say that families, sons and daughters of elderly people, nephews, nieces, grandkids, should not shy away from having a good talk with grandma or grandpa and saying, listen, we love you, we want to take care of you, but you got to do your part and you got to let us help you.
People that come into the hospital setting that have sustained a fall, there are some very common injuries, and I think one of the most common injuries is a hip fracture, unfortunately. And other injuries that we see are extensive bruising. If someone has hit their head, they can have a bleed in their brain, which might lead to a surgery to evacuate the blood out of their brain. There's a lot of different types of injuries that can occur, so it really depends on what happened during the fall and what body part got hit during the fall.
From top to bottom, probably the worst are brain injuries. We fall and hit our head, we have a good chance of causing internal bleeding. As we get older, the older population takes medications that thin the blood to help prevent or treat heart disease and poor circulation, and these drugs can be two-edged swords because they prevent us from clotting, which is exactly what you want to happen if you have an injury. So head injuries and brain injuries resulting in coma and in basically loss of autonomy are really at the top of severity. Then any bone in your body you can break falling, and what we see a lot of are spine injuries, sometimes causing paralysis. Fractured ribs can be severe, especially in our older patients' hips, and not as often, but sometimes legs. These things can keep you in the hospital for weeks sometimes, and then when you're finally ready to leave the hospital, generally we don't go home because we're still too weak from the recovery process. So they can be life-changing events.
The message I'd like to leave with older adults is that yes, you're getting older, but you're still so capable. And there's so many things that you can do to keep improving your life and your health. And one of the most important things you can do is staying active. That's the key thing that's going to help you stay independent.